Welcome to the Nevis Newscast for Tuesday, September 14th, 2021. I am Bronte Swanston Hendrickson.
First, I want to congratulate you and to say how proud we are that Nevis has produced sons such as you.
Premier of Nevis, the Honourable Mark Brantley, recently congratulated Dr. A. Linton Liburd on the occasion of his being bestowed with the Medal of Honour for his outstanding contribution in the field of medicine. The investiture ceremony took place on Thursday, September 9th at Government House in Nevis.
And here was a young man who said from very early, I want to be a surgeon, and who worked assiduously. You realize he didn't get there right away. We are told by his bio that he did a degree first in things like history and Latin. He meandered perhaps, but he never lost focus in terms of where his ultimate goal was. And I'm proud today as the Premier of Nevis, Dr. Liburd, to bear witness and to congratulate you and to be a part of this significant ceremony, hosted as it is by our Deputy Governor General, to honor you with the Medal of Honor, one of our country's highest honors, which is bestowed on those who have demonstrated that they have served and served with distinction. And for me, that is significant.
Among his many accomplishments, Dr. Liburd earned a fellowship of the Royal College of Surgeons in 1978. He was medical superintendent at Alexandra Hospital in Nevis and a surgeon for a short time at Joseph N. France General Hospital in St. Kitts. He established the Liburd Medical Center and was the first surgeon to introduce office surgery in Nevis. He was appointed medical advisor to the Executive Committee of the St. George's and St. John's Senior Citizens Home when it was established in 1993 and served the facility with distinction for many years. Due to failing health, he retired from his medical practice in 2017. Premier Brantley expressed the hope that Dr. Liburd's 5 children would continue in their dad's footsteps.
All of the children of Dr. Linton Liburd, MH, and his wife are now members of the medical fraternity, either as doctors or, in this case, one son who's a dentist. Again, I think we ought to reflect. This is a Nevisian story. Whenever people tell us we're small and you're from a little island and you're from a little village, I think people like Dr. Linton Liburd, his family and the journey that he has taken should remind us all that we are great well beyond the size of our island. That our ambition, our desire to work hard and our desire to achieve ultimately is all that matters in determining how far we get to in life. And so he has demonstrated by his journey what he could achieve. And I am to hope that his children now will continue that very rich tradition and that they too will continue to do extremely well for his family and that the name Liburd will continue to ring loudly here on the island of Nevis as a family that has served and served and served with distinction.
Premier Brantley urged Nevisians to see Dr. Liburd's story as one worthy of praise and reflection. Prime Minister Dr. the Honourable Timothy Harris led a St. Kitts and Nevis delegation that also included the Federal Minister of Health, the Honourable Akila Byron Nisbet, to the 16th Special Emergency Meeting of the Conference of Heads of Government of CARICOM held virtually on Monday, September 13th. Prime Minister Harris and his CARICOM colleagues discussed at length the growing incidences of positive COVID-19 cases in the region and how best the community can work in a unified way to manage and control the spread of the virus. The meeting saw participation from all member states and presentations from various entities such as the Caribbean Public Health Agency CAFA and the CARICOM Secretariat, with special interventions being made by allied partners including the United States of America and the United Kingdom. Monday's meeting became necessary as the CARICOM region is currently experiencing a surge in positive cases, particularly as a result of the emergence of new and more transmissible variants of the virus that is creating additional pressures for health systems across the region. Several countries have begun to implement tougher measures to arrest the situation. For instance, in Grenada, the increase in COVID-19 infections and admissions have forced the government to establish an ethics or triage committee to guide healthcare providers on who should receive care if or when the country's health system is flooded with COVID-19 patients. Other territories are considering extensions of their COVID-19 measures, such as lockdowns and curfews, to contain the upsurge in infections and protect their healthcare system. Still to come, most COVID-19 infections are with the unvaccinated, who takes longer to recover, CMO Dr. Laws. The details after this break.
Yes, I got vaccinated and I am feeling great. So I invite you to join us in the fight against this deadly coronavirus disease. So visit the health center in your area and get vaccinated.
For more information or to get vaccinated, visit your nearest health center. This message was brought to you by the Department of Public Health, Nevis.
Welcome back. Persons in St. Kitts and Nevis with adverse side effects from a COVID-19 vaccine are reminded to file a report with health authorities detailing their experiences.
If you are experiencing any adverse effects, make sure to report it to the health center where you received the vaccine. You can also call 311 and provide us that information, or you can call your physician, your regular physician, to provide us this information.
Chief Medical Officer Dr. Hazel Laws shared other ways that persons can submit this critical piece of information at the September 8th edition of the National Emergency Operations Center COVID-19 briefing. Medical Chief of Staff of the Joseph N. France General Hospital, Dr. Cameron Wilkinson, said that there is an adverse reporting form that is available for persons to document side effects after receiving a jab of the Oxford AstraZeneca or Pfizer-BioNTech vaccines. However, he said that no significant side effects have been reported since the roll-up to roll-out campaign was launched in late February this year. As the third wave of COVID-19 infections continues across St. Kitts and Nevis, Chief Medical Officer CMO Dr. Hazel Laws indicated during the September 8, 2021 NEOC COVID-19 press briefing that most of the active cases are unvaccinated and have shown a longer recovery time. The CMO further stated that the key to COVID-19 recovery is ensuring that persons who have tested positive remain in contact with their caseworker in order to better combat the infection.
So if you're fully vaccinated and you're diagnosed with COVID, the duration of your illness tends to be shorter, anywhere between 7 to 12 days before you get your recovery test. Now, if you're unvaccinated, most of our cases are unvaccinated, your recovery period is longer, and you will be in isolation for about 14 plus days. You will be tested, and then once we get 2 consecutive negatives, you will be deemed recovered and you will be officially released from isolation. Now, if you're a contact of a case and you are unvaccinated, you're automatically in self-quarantine for 14 days. You will get 2 tests, an initial test at the beginning of your quarantine period, and then you will get a second test at the end of your quarantine period.
The CMO further outlined that if a person is fully vaccinated and comes into contact with a positive case, the Ministry of Health will monitor that person for a period of 7 days, which includes testing and possible isolation. Persons who are currently positive for COVID-19 were also urged to remain in contact with their caseworkers in an effort to ensure a speedy recovery. And that's it for this edition of the NEBIS Newscast. On behalf of all of us here at the Department of Information, I am Bronte Swanston Hendrickson. Thank you for viewing.